We've all experienced stomach pain after eating too much, during a stomach bug, or during monthly cycles for women. Usually, we wait it out and the discomfort passes. But what many people don't understand is this: where your abdomen hurts can tell you whether you're dealing with simple indigestion or a medical emergency. Certain locations serve as warning signs, red flags that something potentially dangerous is happening inside your body.
My name is David. I work as a general physician at Mayo Clinic, and a significant part of my job involves helping patients recognize when their symptoms require urgent attention. I've seen too many people arrive in the emergency room far too late, dismissing what turned out to be appendicitis as just a stomachache, or ignoring gallbladder pain until it became life-threatening. The difference between a straightforward procedure and a critical emergency often comes down to recognizing warning signs early.
What you'll understand after watching this is simple but potentially life-saving. There are 4 specific abdominal zones where pain should never be ignored. You'll learn which organs lie beneath each area, what serious conditions cause pain there, and most importantly, when to seek immediate medical care. This isn't about self-diagnosis. It's about knowing when abdominal pain crosses the line from ordinary to urgent. Before diving into danger zones, let's establish a simple framework. Think of your belly button as the center point. Draw an imaginary horizontal line through it, then a vertical line down the middle. You now have 4 quadrants: upper right, upper left, lower right, and lower left. This gives us enough precision to identify which organs might be involved when pain strikes. Place your hand on your right side where your lower ribs end. This region houses your liver and gallbladder. The most common emergency here is acute cholecystitis, gallbladder inflammation, often from gallstones blocking the bile duct. The pain typically strikes after fatty meals, can be severe, and may radiate to your right shoulder blade. Pressing firmly on this area causes sharp, significant pain that worsens with pressure. Why is this dangerous? An inflamed gallbladder can progress to infection or rupture, causing peritonitis, a life-threatening abdominal infection. Liver conditions like hepatitis or cirrhosis can also cause pain here. If you experience persistent, severe upper right abdominal pain, especially with fever or yellowing skin, seek immediate evaluation. The second critical location sits in your upper middle abdomen, just below where your ribs meet its center. The most serious concern here is acute pancreatitis, inflammation of the pancreas. Patients describe it as one of the worst pains they've ever felt: intense, constant, starting in the upper middle and radiating straight through to the back. It typically worsens after large or fatty meals. Pancreatitis is a true emergency because the inflamed pancreas literally begins digesting itself, potentially causing multi-organ complications. Without prompt hospitalization and treatment, it can become life-threatening. This area can also hurt from stomach ulcers or severe acid reflux, but those conditions cause different patterns, usually burning sensations that improve with antacids, not the relentless severity of pancreatitis.
One critical note: upper central abdominal pain with shortness of breath or arm pain might actually be a heart attack, especially in women. When in doubt, call 911. Beneath your left rib cage sits your spleen, part of your immune system. The spleen normally stays tucked safely under your ribs, but trauma from car accidents, falls, or impacts can cause it to rupture. This is catastrophic because the spleen contains enormous blood volume. A ruptured spleen causes life-threatening internal bleeding rapidly. Certain infections, like mononucleosis, can enlarge the spleen dramatically, making it fragile and vulnerable. If you experience left upper quadrant pain after trauma, or if you're feeling dizzy or lightheaded alongside the pain, this warrants immediate medical evaluation. Your spleen is not an organ to take lightly. Perhaps the most well-known abdominal emergency, appendicitis. Understanding pain progression is crucial here. Appendix pain often begins as a vague discomfort around the belly button.
Then, over 12 to 24 hours, migrates to the lower right quadrant. Once settled there, it becomes constant and progressively worse. The distinctive feature is relentless escalation, starting as a dull ache, intensifying hour by hour, worsening with movement or coughing. It's typically accompanied by fever and loss of appetite. Why urgent? An inflamed appendix is a ticking time bomb. As pressure builds, it can rupture, spilling bacteria into your abdominal cavity and causing severe peritonitis. A ruptured appendix transforms straightforward 30-minute surgery into complex, prolonged hospitalization. Surgery for an intact appendix is simple with quick recovery. Surgery after rupture is far more dangerous. For women, one crucial addition: lower abdominal pain can signal ectopic pregnancy, where the embryo implants in the fallopian tube rather than the uterus. If the tube ruptures, severe internal bleeding follows. Women of childbearing age with lower abdominal pain in a missed period must consider this emergency possibility. When your entire abdomen hurts with cramping waves, it usually indicates intestinal issues. Food poisoning creates this pattern. Your body tries expelling toxins through vomiting and diarrhea, causing waves of cramping across your whole belly. Menstrual cramps create predictable lower abdominal pain tied to monthly cycles. The key difference: serious emergencies create localized, persistent, progressively worsening pain in specific zones. Benign causes come in waves with periods of relief. Seek immediate medical care if you have severe pain in any danger zone that's worsening. Pain with fever, dizziness or lightheadedness, persistent vomiting, blood and vomit or stool, rigid or extremely tender abdomen, severe pain after trauma, you're pregnant with lower abdominal pain, or pain unlike anything you've experienced before. Trust your instincts. If pain is severe enough that you can't function normally, or you have a gut feeling something is seriously wrong, seek evaluation. Better to be checked and reassured than to delay care for a rapidly worsening condition. Mild cramping that comes and goes or improves after bowel movements usually doesn't require emergency care, but if symptoms persist beyond 48 hours or worsen despite home care, follow up with your primary care physician. These 4 abdominal regions, upper right, upper central, upper left, and lower right, represent where serious, potentially life-threatening conditions most commonly announce themselves. Understanding what lies beneath each area and recognizing warning signs doesn't mean self-diagnosing. It means you're equipped to recognize when your body signals danger. In emergency medicine, we talk about golden hours, critical early periods when intervention prevents catastrophic outcomes. For appendicitis, it's before rupture. For pancreatitis, before multi-organ complications. For ruptured spleen or ectopic pregnancy, before severe blood loss. By recognizing concerning pain patterns and seeking timely care, you give yourself the best possible chance at a favorable outcome. I've seen patients who came in promptly with appendicitis, had straightforward surgery, and went home within 36 hours. I've also seen patients who waited days, arrived with ruptured appendix and sepsis, and spent weeks fighting complications. The same condition, dramatically different outcomes based on timing alone. Your body communicates remarkably well when something is wrong. Pain is not an inconvenience, it's information. When that pain localizes to one of these 4 critical zones, when it intensifies rather than improves, when it's accompanied by fever or other concerning symptoms, listen to what your body is telling you. Seek evaluation from a healthcare professional who can perform proper examination and determine whether you need intervention. Keep this knowledge available. Share it with family and friends. And if you or someone you care about experiences severe abdominal pain in one of these danger zones, you'll know this is not the time to wait. This is the time to act. Your health and safety are worth protecting. That's not being overly cautious. That's being medically wise.